Our daily census at midnight was 548 patients here at Bryan. As far as testing is concerned, we have now administered 25,853 tests. There have been, unfortunately, 2,981 positives, and right now we have 164 pending results. Those are exclusively from urgent care and drive-through yesterday, where we had 113 people go through our drive-through and 46 people received tests at urgent care. The number of COVID-19 positive patients currently in our hospital sits at 49. 24 of those patients are from Lancaster County and 25 are from outside of Lancaster County. There are 2 additional patients, one from Lancaster and one from outside of Lancaster County, that are in-house and pending their test results. And right now, of all those patients, 10 of them are on ventilators. 6 of those are Lancaster County residents. Of our positives, 15 are in the intensive care, 4 are in our progressive care units, and 30 in our general care. If there are questions related to COVID after Dave, I'll be back up to field those to the best of my ability. But until then, glad to present to you Dr. Miers. He was here, I think, our first week of these briefings talking about how to cope with COVID. As we've learned a lot clinically, they've been watching this on how it impacts people physically and mentally. So, Dr. Miers, it's all yours.
This is Mental Illness Awareness Week, and today specifically is National Depression Screening Day. Probably one of the most important National Depression Screening Days since National Depression Screening Day started more than 20 years ago. The Center for Disease Control released a report in August, and that report said that in June of 2020, they reported a 40% increase in mental health and substance use concerns in Americans compared to that same time period in June of 2019. So that's alarming, and that's right a few months right after the pandemic started. So we know that mental health and substance use concerns are up in Americans, and with the social isolation and so forth, we do need to pay attention and do need to get individuals screened and get them connected to resources as appropriate. So today I'm going to address depression, but I'm also going to address grief. It's important that we distinguish between the two, and that to also identify and recognize that all of us are experiencing many different griefs right now. The world is changing, even if it's a temporary change. I mean, the pandemic is going to end, and those changes, some of those changes will go back to normal, but some of those changes that have happened are going to stay. And we are going through a loss of connection. Those connections are, many folks are working from home, so we've lost that connection to our coworkers. That loss of friends, loss of family, and really that loss of normalcy. There's also a type of grief called anticipatory grief. And generally that type of grief is when we receive a diagnosis, like a dire diagnosis that we receive, and we know that death is pending. And so right then grief starts for us. In this instance with the COVID-19, anticipatory grief is with COVID-19, it's the unknown. We're all still faced with the unknown. When is this pandemic going to end? And it really breaks our sense of safety. So it's really important for us to understand the 6 stages of grief. So the first slide that we have talks about Kessler and Ross and their 6 stages of grief. Now, it's important to know that we don't just go through these 6 stages of grief in order. A person can go and jump into any of these stages of grief at any point in time. But I've dialed these down and applied them to the pandemic. So an individual who's going through grief and might be in the stage of denial might be saying, this isn't going to impact me. This virus is happening, but it's not going to hurt me. Individuals might be going through a stage of anger. You're making me stay at home. You're taking away my activities. This is really upsetting me. Individuals go through a stage of bargaining. What if? What if I social distance for 2 weeks? What if I wear the mask? What if I wear my goggles at work? What if I do these things? Things are going to be all better, right? Some individuals do go through a period of sadness, depression, because individuals get tired and they say, I don't see an end to this. But then individuals reach a period of acceptance where they say, this is happening. I have to figure out how to proceed. But then David Kessler, later on, after these 5 stages of grief were developed, he added a 6th stage of grief. And that stage is finding meaning, where we look at, what just happened? What happened that caused this grief? And I want to find a sense of meaning and purpose for what we're going through. But oftentimes with grief, it's important to know that sometimes that grief can turn to depression. So what can I do? Well, it's important to understand the stages of grief. So the next slide, I think it's important to understand, well, what can I do? Understand the stages of grief. It's important to find the balance in your thinking. It's important to let go of what you can't control. In terms of finding the balance in your thinking, it's important to find, when you're having negative thoughts, you're thinking about, when you're depressed and you're thinking about how bad maybe the pandemic can be, it's important to turn those thoughts around and to think positive things. It's important to let go of the things that you can't control. You might be upset about, wearing the mask and having to social distance and those types of things. We need to take control of the things we can control. Those things you can control. And it's important for your sense of safety and for the safety of all of us to do those things. But it's also important to stock up on compassion. When we're around individuals who normally are very polite, and we might see individuals who are a little bit more irritable, and we're like, gosh, what's wrong with that individual? They're usually very kind. Well, when a person's going through a period of a stage of grief or they're depressed, they might be a little bit irritable. And so that's where that compassion comes in. It's important to know that we just need to cut folks a little bit of slack once in a while and to know that we're all going through a tough time. It's important to build connectedness with friends, family, and the community. To know that when research shows that building connectedness with others reduces suicide, it reduces depression, and it helps individuals lead healthier lives. Then the last thing is understanding depression and then when to seek help. So we do need to know what is depression and to understand depression. So the symptoms of depression are, I'm not going to go through all of these, but on the screen are the symptoms of depression. And the most common ones that individuals talk about are losing interest in usual activities. So yes, we're supposed to be social isolating. And that's one thing that's a safety measure for the pandemic. But it is also a risk factor for depression when somebody becomes isolated and is not doing the things that they normally like to do. But there's a difference there. We can be isolating to be safe, but we can be isolating and still not actively engaging in the things that we normally like to do. So that's why it's important to be connecting with our friends and family and to know if that individual that we care about, if their behaviors have changed. If somebody's losing weight or gaining weight during a 2-week period, it's important to take note of that. If somebody's sleeping too much or too little, we need to take note of that. If somebody's feeling worthless, guilty, or hopeless, it's important that we take note of that. And if somebody's having problems concentrating or making decisions, or if they're having thoughts of suicide, it's important we take action right away and call the 1-800-273-8255 number or get them to the nearest emergency room right away. But if somebody's having those symptoms for a period of 2 weeks or more, we need to get them in and get them evaluated as soon as possible. But if you're not quite sure, the National Depression Screening Day we've made it very easy for individuals to do this from the comfort of your home and to go to the bryanhealth.org website and click on our screening and go and click depression screening. It's free, it's confidential. You go through and you answer some questions. At the end of those questions, it will tell you whether or not the signs and symptoms are there of depression and what next steps there are to take. The other piece that we have available here at Bryan Medical Center is our mental health emergency department. It's the only mental health emergency department of its kind in the United States, one of the few in the United States, where we have a dedicated emergency department for mental health needs right here at Bryan Medical Center, at Bryan Medical Center West. 24 hours a day, 7 days a week. And if somebody's in a mental health crisis, we are here to assist and to determine if hospitalization is necessary. But if you're not quite sure, go take an online screening. It's available for substance use, for depression, anxiety, multiple mental illnesses that you can go and take a screening. So I encourage you to do that.
Not specifically at the ones that we have an ownership stake in, Merrick and then Creed Area Medical Center, Merrick Medical Center and Creed Area Medical Center. But yeah, throughout the Heartland Health Alliance, people are feeling pressure. And is Custer Broken Bow? Yeah, I did see just before I came in here that the Broken Bow Hospital put out an alert that they are feeling really pinched up there. So I think we're going to continue to see this, Matt, as this kind of rolls through the state. It's clearly into rural America right now.